Assalamu alaikum. This is a video of one of the early days when I started laparoscopy way back in 2018. So we were performing a right-sided radical nephrectomy, and so I dissected the lower pole and then dissected the pedicle. The pedicle was a bit complicated. There was a vein which was anteriorly coming to the inferior vena cava, and there was another vein which was posterior. And along the posterior vein, we found an artery, which was a smaller one. So we clipped that artery, and now dissecting the upper border of the renal vein, and we found another main bigger artery which was coming to the hilum. So we dissected that as well, so that get a full control of the arterial system, so that the veins can then be individually ligated and divided. So the vein was dissected and the artery was separated from the vein. The tissue around the artery was dissected nicely. It was a very clean dissection with the ligature. So the purpose of this video is number one, showing the problems with the metallic clips, and number two, cutting the vessels or dividing the vessels after applying the clips with the energy source that might be ligature or harmonic. So here we have applied 2 clips proximally on the artery, and one metallic clip is applied on the artery towards the hilum or towards the kidney. Then the vein was quite big, and so I thought of using the extracorporeal knotting with Bhandarkar knot pusher. This reduces the lumen of the vein, and so the clips can then be applied easily. So we apply one smaller clip towards the inferior vena cava and nicely clipped the vein. Then I'm applying the metallic clip towards the hilum, and then the idea is that we will cut it between the suture and the metallic clip. So the problem here is that the clip did not completely cover the whole vein, so it started bleeding, and that led to the fact that I had to use the ligature to control that bleeding. So after cutting it with an energy source, the metallic clip that was on the hilum towards the kidney side, it got unstable, and due to that instability, it created a problem later on. So we cut the bigger artery as well between the clips. That's why the cutting of the pedicle, the veins and the artery is recommended with the scissor, because it's a clean cut. So the main problem happening here is now that we have clipped 2 arteries, so we are sure that the arterial system has been controlled, so the veins will not be engorged after clipping. However, the opposite happened. When we applied the clip, the pressure within the system got big, and the metallic clip which was used on the vein side towards the kidney, it also got destabilized, and because of the higher pressure in the venous system, there might be some missed artery or one of its branches, which has led to the fact that the kidney is engorged, the venous system is engorged, it is bleeding under pressure, You can see that the small vein, the vein which was very small, has engorged to a size bigger than the main vein. So now it is extremely difficult to place a clip. Number one, to control the bleed. And the bleed was, first you have noticed that it was a darker color, but now it is becoming more and more bright red. So we are trying to apply a clip, but the vein has retracted and it's difficult to apply a clip. So we apply a clip which has temporarily decreased the bleeding, but this control of the bleeding has further made the vein engorged. So after cleaning and suction, we place a gauze piece which can clean the area. We can do suction over it, and in the meanwhile we are thinking and planning what to do. So we decided that a suture with an extracorporeal knotting has to be placed on the engorged vein, because the clip may not be applied effectively. But once we have applied this extracorporeal knot with Bhandarkar knot pusher again, the area which was so much engorged between the clip and the suture, somehow by itself the engorgement was just gone. And I don't know what happened during the process that this engorgement disappeared. Since it is high pressure and under pressure, and now I'm trying to see and trying to think as well and plan what to do, whether place another clip proximal to this clip or towards the IVC, or place another suture on this area, this one. So suture was a reliable option, so I decided to place another suture. But after applying this suture, somehow you can see that the engorgement of the vein has disappeared. But one thing is for sure, that we are moving closer and closer to the renal hilum, due to which the number of the veins and the arteries will definitely increase. So the artery and the vein is disconnected, but there is still bleeding from that old site. So things are getting more and more fussy as we proceed. As the proximally the hilum is completely under control, we decide to cut everything and disconnect the kidney from the medial aspect. So we move on to cut the artery. So we apply another clip before dividing this artery, and after applying this clip we'll try to cut the artery and divide it. But you can see that the use of ligation has made the hemolog clip unstable and it has slipped from that artery. However, proximally everything is under control. Now you can see that the kidney has been disconnected from all the medial structures which are considered to be vessels, the veins and the artery. However, if you see that old place that still is bleeding, and it seems to be some arterial bleed, and we are unable to find that artery which is feeding this area. So now the further plan is to quickly disconnect this kidney from the remaining of the medial structures. However, you can see very clearly that we are dividing the vessels just over the renal hilum or very close to the kidney. That's why we encountered many vessels. However, initially we were working towards the big vessels. Even then the arteries were more. And the kidney has totally been disconnected from the medial structures. Even then the area is bleeding. So now we think that this might be the retrograde blood that is coming. So we move on and we separate the kidney from the medial structures. So things got very dirty, very fussy. However, we kept on going, and by the end you can see that medially there were 2 arteries that are clipped, and there are 2 veins which are clipped, as well as ligated with the extracorporeal suture. So avoid metallic clips, avoid overstretching